today we are using the Legend Pro to treat Monica. Monica's here today to treat her texture, the texture on her face. She has prominent pores. She has had acne over the years, has some hyperpigmentation, brown spots from the acne, and just overall would like to have her skin tighter and smoother. So we are using the Voluderm today to try to affect that mid-dermis and papillary dermis to contract and to stimulate collagen production. And then with the microneedling, with the radio frequency that's being emitted as the ultra-thin needles go into the skin, they're warm and they sort of push easily through the skin like a warm knife through butter, which really helps people tolerate the procedure well. Doesn't really hurt, they feel fine. And then as you continue to treat, you build heat, so you get this low level of redness that starts to occur. And we'll talk about that as it happens, and you can tell me how you're feeling through the procedure. Okay. So we're using the 36 long, we're using slightly longer needles because we want to make sure we get good texture change in her skin. So we'll get started. So I am starting, because this is the first time Monica's had this treatment, with the lower of the three settings. There's low, medium, and high. And that's a 10% power out of a total 50 watts that are possible. And then for the exposure, we're going to expose 15% of her skin to the treatment out of a possible 400 millisecond duration. Right? So you can have a 400 millisecond pulse duration, but we're going to use 15% of that today just as we get started. And then we'll do 2 passes. So I already did one test area here, which Monica tolerated really well. So we're going to continue along this path along her jawline. Tilting the skin a bit to pull it away from the bone. So you press gently, press your foot pedal. I felt a little vibration, which you heard too.
Yes.
Right? And then the light turns green and you can release. So you're looking for a little bit. You can see these little tiny little places where the microneedles inserted. No redness yet. I'm overlapping 50%. How does that feel?
It feels good. All you feel is like the vibration a little bit. That's it.
So we're going to go in our next row now. 50% overlap of the squares. And you want to treat the whole area. You know, a lot of times when people treat acne scarring, they'll try to focus just on the acne. Really, you want to treat the entire area, but you can definitely be more aggressive over the specific scarring areas. If you treat the entire cheek, then you'll get that tightening all the way across. I think of it like pulling a bedspread on one side and the whole thing flattens out on the other side of the bed. So that's why you want to treat everything. Okay, so now we're going to go back over the same area, but we're going to turn a 45-degree angle so that we don't get the microneedles inserting into the identical holes. So the Voluderm microneedles go 1 millimeter in depth, deep into the skin. And that's really the perfect depth to get that collagen stimulation in the mid-dermis and the papillary dermis. You'll have some devices that will go deeper. But that, as it starts to get into that deep dermis and the subcutaneous fat, it's really not doing what we need, which is tightening of the skin, creating more collagen so that her facial skin remains as tight as possible. The thing about the Voluderm is that with the parameters on the machine, you really have a lot of options as you treat your patients to increase the amount of exposure time, you know, that pulse duration, and increase the power. So when someone returns, you can judge how long it took for them to. So you're following up, asking them questions that then can inform your decision about how much to increase your energy settings. So as I look at Monica's skin, I see this very slight redness, which many times can be more difficult to notice in people of my coloring. And so, but if you wait, you can see this delayed erythema with a little bit of edema. You can see a little bit of edema right around where the microneedles were. It's very smooth, very even in color. You're looking to see if you have any skipped areas, because you can always go back and treat those areas well. So I'm going to get her chin here. And then and get this area of your lip, just because I see that. Make it really even around her eye. Okay, good. So I'll treat the other area. How does that feel?
Good.
The same thing. Stretch the skin a bit. 50% overlap. Press right over that bone. Stretch the skin up from the bone a bit. You know, whether you go vertical or horizontal doesn't really matter. You're just trying to make sure that you know the skin that you've treated and that you have a good, consistent grid pattern so that you know where you've been and where you need to go. So one reason why the radiofrequency microneedling is good for skin of color is because it's targeting water. So it's not targeting a chromophore, it's not targeting melanin in the skin. And since the skin is predominantly water, it's very effective, but it can avoid directly impacting the melanin or the pigment in the skin, so that it's good for all skin types. The other nice feature is that with radiofrequency, we don't need to use goggles. So many of our devices, we have to use goggles, we have to use gel, and none of that is required. You do need to have a very clean skin surface. I cleaned Monica's skin before this procedure, removing all of the oil, and then thoroughly dried her skin. Because again, this works with water, and so we want it to affect the water inside the skin, not the water on top of the skin. How do you feel?
Good.
Does it feel a little bit more on the first side we did now?
The first side, I started to feel like some tingling.
Right, so it's starting to build that heat, which is good. It's going to affect the change that we want.
Okay.
So that's a good thing. Okay, so we're going to come down this middle part. I'm going to get some of these really early vertical crease lines you got there. We're going to get rid of those before they even start.
Keep me looking younger longer.
Exactly. No acne scars, and we're going to keep your fine lines tight. You know, I really like that. You know, what just happened with the machine is it will not actually do the pulse unless you're doing it appropriately, which is good. So it's got some safety measures on it that make sure that you're doing your procedure in the best way possible at all times. And so for me, I often, after every procedure, I have a photograph taken of the screen so I know exactly what was done. You're good. How do you feel?
I feel good. It's just more tingling on the right side.
On this side, the
Yes.
first side done. Yeah, this is going to catch up in a minute.
Yeah, I feel like it's like inflamed. So that's
Make
normal.
a little tingly. Yeah, warmth, a little bit of tingling.
Right.
All that's normal. So
but
then
it's not burning or anything. It's just, you can tell it feel like it's getting a little heavy, like it's working.
So on a scale of 0 to 10, with 10 being the most painful, what would the number be?
Oh, I say about a 4 or 5. Yeah.
Okay, that's good.
Very tolerable.
It looks good, because the good thing about that is we know that you're generating the heat that we need to try to produce the collagen.
Okay.
And get some of these pores to shrink wrap, tighten up, and then produce collagen underneath to be nice and smooth. So then when you come back the next time, usually we treat every 1 to 2 weeks for Voluderm, and then we can see and adjust the parameters depending on how you tolerate the procedure. What happened afterward. Okay?
Yes.
Thank you very much, Monica.
Thank you. Okay, when I came to her, I had a problem with a lot of ingrown hairs, and I had a full mustache and like a beard coming. And we did a testing strip to see how it would react to the actual laser. So when we did the testing strip, the hair didn't come back. So that made me continue to keep coming. So I've had a total of about 7 treatments so far, and my skin has improved drastically from that. It's changed my life for the better, because I could go out, I'm not embarrassed. I don't have to spend $60 getting waxed every 2 weeks, every week and a half. Okay, today I had the microneedling treatment, and that was because I have a lot of blemishes and pores that needed to be corrected. So she decided to try this treatment on me to see how it clears up, it speeds up the collagen and helps clear up some of the blemishes away from me. The treatment felt fine. It didn't hurt after the treatment. It just, you just feel warm and fuzzy all over your face, if that makes any sense. Yes, it wasn't long, about a good, I'd say 10 to 15 minutes. Absolutely, I refer a lot of people to Dr. Diggs. She really cares about her patients and she's thorough. So yes, I think that this would work for anyone of color who has problems with hyperpigmentation, as I do.